And before we get started, I made a note to myself, and I don't know if this is reassuring at all or not, but when I graduated from PT school in 1985, and that was all I studied was physical therapy.
Mhm.
I mean, it took me honestly a good 3 years for me to feel like I really was in my groove.
Mhm.
And when I started practicing, and I was practicing in the nursing home, I had, because in Colorado, you could practice once you graduated, but you had to have a licensed physical therapist sign off on your notes and stuff till you took your licensure exam.
Mhm.
So I had a mentor, with me who was an associate director at the local hospital, who then invited me to come to their lunch and learns and all that. So I got to network with the therapist there. And so it just took some time to really feel like I was in my groove. But even then, after years of experience, and then if I'd go and work with a different company, that would even take me like 6 months to feel like I was in my groove. So I'm really amazed about how you're progressing, Elizabeth, with everything that you're doing and trying and thinking through. And all. I mean, I think you're doing a wonderful, wonderful job.
Thank you. I'm trying to be really thorough, and I feel like my skill set will catch up with the thought process eventually.
Yeah, 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 yeah.
So, but I mean the core idea of how to approach rehab for animals is established through all of the curriculum that we have. So you give us all the tools. It's just a matter of then organizing it and then
Right.
figuring it out, like what pieces of those make sense for each patient. And that's the tough part in the beginning.
Yeah. It's a lot to sift through, and then eventually you'll find your own way of going through things that feels smoother and whatnot. It just, it's a process, but yeah,
Mhm.
you're doing
Well,
great. So
I
go
think so
ahead.
too. Yeah, well, and I think just expecting that there will be a trial and error aspect, even down the road, Deanna, right? I mean,
Oh, yeah.
so I think setting that expectation for yourself and for the client, because we don't know, even if the dog spoke English in full sentences, you don't always know. So
Mhm.
it's just what works, and the condition evolves, and patients over time get older. So, right.
These dogs always just amaze me. And they didn't read the books. They don't know how they're supposed to be doing. So,
Right, right. And even the literature, I think, I mean, I saw the article, I thought you sent the article with surgery and menisci. I mean, it's just like before we do any of that, like there's so many modalities that even if we have a certain paper, even if it's in veterinary medicine, did they try acupuncture? Did they do it from a neurologic and myofascial
Mhm.
perspective?
Mhm.
And what about laser? So there's so many more new things and better approaches that I don't even think that there's literature out there that actually reflects what a practice that's so multimodal and science grounded and Deanna
Right.
informed, and the assessment. Nancy made the comment the other day. We were just because we're sponsoring so many different rehab kind of talks and meetings and everything, and just seeing like and you see this all the time. Somebody's got an animal, or Instagram, anything like that. There's an animal doing something. And Nancy said, none of them are doing like Deanna does, where you might have a treat and she's assessing. So
Mhm.
that's the secret sauce of Deanna. One of them is like monitoring. Is this exercise doing what is it? So what needs to be activated? Why are we doing a certain therapy physically, and are we getting the response out of that exercise that was the intention behind it?
Mhm.
And if not, then that has to be modified. But you just look at what people are doing. They're putting animals through paces, but they're not really seeing, is that happening?
Well,
Right.
and even in the human field, like I was looking
Yeah.
up and I found this the NIH is currently doing a study with the National Institute of Arthritis and Musculoskeletal and Skin Diseases. And they're studying, it's called TEMPO, and it is the treatment of meniscal problems and osteoarthritis, because it's like, okay, we're getting to where we feel pretty established that in humans, particularly elderly with arthritic knees, meniscal tears probably don't do great with, well, certainly with partial meniscectomies. Root and meniscal repairs, that's a different situation. And we know that trying conservative management, physical therapy, ice, activity restrictions, anti-inflammatories, blah, 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 helps. But what kind of physical therapy helps? We don't know yet. Because there's all different kinds of therapy that's being done. And so that's what they're going to be studying. I looked to see if they had any results posted yet, and they don't. In fact, they're still taking people in for their study, but it's exciting. They're going to be looking at 4 different kinds of therapy interventions to see which ones might work the best for the meniscal stuff. So I'll keep you posted when they get that done. But I mean, we're still figuring this out.
Yeah. And laser, I don't think has taken off so much in human.
No.
And there's so much that can be done to nourish that tissue with the
Yes.
menisci. And I think, help it. It's not just a done deal that it has to have surgery.